Bowel cancer is one of the most common cancers in Tasmania, affecting hundreds of Tasmanian families each year. The National Bowel Cancer Screening Program is a free screening program for people aged 45 to 74 years. It uses a simple at-home screening test every 2 years to find tiny traces of blood in your poo that you can't see for yourself.
About 1 in 20 Australians will get diagnosed with bowel cancer over their lifetime. That equates to about 15,000 new cases per year in the country.
So the Tasmanian Department of Health has a focus on cancer screening, prevention and early detection. This includes through the Tasmanian Bowel Cancer Prevention Program, where we've got a dedicated team of local bowel screening nurses. Our aim is to make screening as supported, accessible and informed as possible.
A cancer is an abnormal growth, so bowel cancer, also known as colorectal cancer, is basically a cancer on the inside lining of your bowel. Some of the common risk factors associated with bowel cancer are age, diet and lifestyle risks, having a family history of bowel cancer, and having conditions that cause inflammation in the bowel, such as ulcerative colitis and Crohn's disease.
Bowel cancers tend to grow very slowly, and so in the first part of the disease there aren't any obvious symptoms and signs. So the magical thing about this test is that it can see very small traces of blood in the poo. And this is before you can see it with the naked eye. So it's critical that people have this test so that we can catch the cancer in its very earliest stages, because then we've got the best chance of successful treatment for that patient.
It's really important to understand that a positive test is not a bad thing. It enables us to find a problem when it's early and can be easily treated. Very small numbers of patients will get a positive result, and it's those patients that will then have some form of investigation, and that's normally a colonoscopy with a gastroenterologist or a colorectal surgeon.
In fact, the commonest causes for a positive test include things like polyps, hemorrhoids or piles, and inflammation on the inside of the bowel.
GPs can now hand out kits to patients or help them to order those kits online.
Our role is to support the participants through their pathway. Being local to Tasmania is a big thing for the participants to know that we are Tasmanian based also. We have knowledge around the system and we are able to provide support and education to those who aren't as familiar with the process as we are.
Yeah, I think that local support is absolutely key. They know the resources that we have here and they'll be best placed to navigate you through the system here in Tasmania.
Some people can be put off doing their bowel screening tests because they think it's yucky, they think they might have to touch their poo. But what we know is that people who've done their screening test once, they learn how simple, clean and easy it is to do, and they're far more likely to do their test the next time they get it in the post. Screening for bowel cancer only takes a few minutes, and it's the best way to find bowel cancer early, when over 90% of cases can be prevented or successfully treated. So if you're aged between 50 and 74, you're going to receive a screening kit in the mail every 2 years to your Medicare registered address, and it's really important that you do that test. And if you're aged between 45 to 49, you can also request to join the program. You can do this by requesting a kit online or by phoning the National Cancer Screening Register. You can also talk to your GP and check if screening is right for you, or if you have any questions about the screening program, you can talk to your local bowel screening nurses.